Hello, everyone. It's DrCary Yurkiw, and welcome to our webinar today on stretches for neck pain. I'm glad you could join us, and today we're going to go over different stretches that patients do to help with their neck pain. I've been in practice for over 26 years now, and I went to school in Toronto to the Canadian Memorial Chiropractic College, and then started practicing by doing locums. And a locum is when you take over for a chiropractor when they're on holidays or if they've been hurt. So I did locums for 3 years and then started my own practice. I've seen hundreds of cases of neck pain over my career, and currently I practice in Kelowna, British Columbia. So today we're going to go over different types of neck stretches. Just before we start, it's important to have your specific condition diagnosed by a health professional. I would encourage going to see a chiropractor in your area, having them check your neck, diagnose it properly, and then give you the right recommendation for treatment and the right stretches for your neck condition. Today, we're going to go over general stretches that I give patients, but it's better to have specific recommendations for your particular problem. So let's go over the anatomy and physiology of the neck first, so you can understand that. And then we'll go over different stretches you can do. So first of all, there's 24 vertebrae in the spine. 7 are located in the neck region. And the bones in the neck form a forward curvature called the lordosis. There's discs in between the bones in the neck. They're like shock absorbers. They cushion the spine and allow enough space for the nerves to come out on the right and left side of the spine. There's joints and cartilage. So there's the disc in the front, 2 joints in the back, which are called zygapophyseal joints or facet joints, and they allow the bones to glide over one another. There's cartilage on top of the bone that protects the bone from wearing out or breaking down. And these joints allow you to move, bend, and twist. The spinal column protects the spinal cord, and the spinal cord is sending messages from the brain down the spinal cord and then to different parts of the body. So from the neck, the nerves travel down the arms right to the fingertips. From the low back, the sciatic nerve travels down the leg and goes right to the tips of your toes. So the nerve flow, the nerve supply is going to all the parts of the body, including the organs, the lungs, the heart, the stomach, the digestive system. The nerves control everything. The cardinal movements in the neck area are flexion, bending forward, extension, bending backward, twisting or rotation, right and left, and then side bending, bending your head sideways, your ear to the shoulder on the right and ear to the shoulder on the left. I find patients have the most difficulty with extension because of the joints that we went over, these facet joints in the back part of the spine with the nerve coming out in the back portion of the spine. It can pinch the nerves and cause tissues to get pinched in that area. So extension is the most difficult for patients. And I usually caution my patients on doing those extension type of exercises. Kind of leave that till later. I'll give other stretches and then I'll add on the extension exercises later. So for stretches, what do? Well, they help loosen the tissues in the neck area. They maintain the work that we're doing in the clinic. So when we make adjustments to the spine to increase the range of motion and the alignment, the stretches help to maintain the changes we're making in the clinic. The stretches promote healing, so they increase blood flow, they increase circulation in the area, which really helps the joints to heal. And they also, stretches improve the coordination of the nerve and muscles, something we call proprioception. The neuromuscular junction is something that needs to be worked and to repair that junction. So doing stretches helps to improve the connection between the nerves and the muscles. One of the more common stretches I recommend is flexion, and flexion is bending your head forward, this one on the left. So by bending your head forward, it stretches the ligaments in the neck area, and it helps the muscles to get stretched, in particular the back part of the neck area right here, the extensor muscle group along the spine. We call them the paraspinal muscles. It helps to open up and stretch the discs in between the bones. I tell patients to go as far as they can that they're comfortable with no extra pain. So if patients start feeling sharp pain while they're doing this, it's uncomfortable, I tell them to stop. And that's the limit of their range of motion. Hold this for 2 to 3 seconds, do this 2 to 3 times, and that's a good way to start. And then work yourself up to 8 to 10 repetitions of this exercise. For extension, this is one of the more difficult ones. I tell patients to gradually do extension and start with only 25 to 50% of the range of motion. So just gradually put your head back just gently. You could use a rolled up towel for this. So you could put a rolled up towel on the ground and then just lay on that towel. The position of the towel could be right in the neck area or in the upper part of the back. A lot of times I'll look at the patient's x-rays and then tell them where to position their towel to get the maximum benefit. So this is the advantage of having a chiropractor or a doctor check your neck and do x-rays, because then specifically we can give the right exercise for that condition. This is more of a passive stretch. So when you're lying on your back, just resting your neck over the towel, it's passively stretching your neck with gravity. Shouldn't be any extra pain with that. Hold this for 2 to 3 seconds. Start with 2 to 3 repetitions and then work yourself up to 8 to 10 times. For a rotation, you could do this standing or sitting or lying on the ground. And this is working a different muscle group. There's these scalene muscles in the front part of the neck, sternocleidomastoid muscle from the skull down to the collarbone. So the different muscles are worked by neck rotation. And if you lie on the ground and turn your head to the side, or if you're sitting or standing, this will work the rotation muscles. Do this slowly. Feel the stretch in the neck, and often you feel the opposite side with this. So when you're turning your head to the left, you'll feel a stretch on the right-hand side. Shouldn't have any extra pain with this. Do this for 2 to 3 times, and then work yourself up to 8 to 10 repetitions of this exercise, holding for 2 to 3 seconds. Side bending, or what we call lateral bending, is good to stretch the neck muscles. So tipping your head, your ear to the shoulder on the left will stretch the lateral muscles, side muscles in the neck area on the opposite side, including bigger muscle groups like the trapezius muscles. So the trap muscles will get stretched by tipping your head to the opposite side. You could put your hand over your head to help. So lifting your left arm in this case and putting that up over your head and helping with that stretch is good. I wouldn't force it though, so make sure you're not feeling any extra pain, and I wouldn't bounce. So make sure you're not kind of doing any type of jerking movement, because that could create more pain for you and cause the muscles to tighten up. Do this for 2 to 3 repetitions, and then work yourself up to 8 to 10 repetitions of doing the side bend, and make sure you do both sides. I would alternate doing the left side and then switching over to the right side. That'll just keep a nice balance for both sides. Even if you have neck pain just on one side, it's a good idea to do both sides, because we really want symmetry in the muscles and we want equal amounts of flexibility on either side. This is called the cat-cow stretch. This is a yoga type of stretch. And I really like this because it's a very gentle stretch. If you kneel on the ground and then extend your neck backwards, this is really good to stretch the front part of the neck muscles right here. Often this exercise involves arching the back as well to stretch the lower part of the spine. So you can do it not just for the neck area, but for the lower back as well. This really feels good. And then when you go from the extension type of position to the flexion position, it's working the opposite muscles. So it really helps to stretch the back part of the neck and then the back part of the spine. So this is a cat-cow stretch. It's often done in a fluid movement where you extend your neck and your back, and then you gradually go from there. You don't really hold that position. You go back to this position, and then you alternate going in a fluid type of movement. Hold this for just for a second or two. You could do up to 3 seconds when you're going through the full movement. So spend about 2 to 3 seconds going from extension, going to flexion, and then back to extension. So kind of have a cycle that would take 2 to 3 seconds alternating between these two positions. And then you can do 2 to 3 repetitions of this, 2 to 3 cycles, and then work yourself up to 8 to 10 cycles of this activity. The other stretch that's good for the neck and shoulder is just pulling the arm across your body like this. And some people like to do it on the floor. So they're actually have their head down like this. Some people lay flat on the floor. Whatever is most comfortable for you. Again, these stretches are just to increase the flexibility of the muscles. You shouldn't really be forcing it or feeling any type of extra pain from it. So just lying on the ground or in this position with your arm underneath your body will stretch the rotator cuff and the neck muscles. Or you could do it sitting or standing like this, pulling your arm across your body, stretching the rotator cuff, which is the muscles in the back part of the shoulder blade, and then the muscles up into the neck region. This generally feels really good. You can hold this for 2 to 3 seconds and then alternate. Do the other side for 2 to 3 seconds and then go back. So alternating right to left, and do 2 to 3 repetitions of each side, and then work yourself up to 8 to 10 repetitions. If you do have neck pain and you live in the Kelowna area, you can call our office to book an appointment. We are currently accepting new patients, and our phone number is 250-486-0062. I did write a book on neck pain. It's on Amazon, and you can get that on in an ebook format. You can also get it in paperback and an audiobook on Audible. And you just have to type in neck pain and then type in my name, and you'll find that on Amazon. It is in the Kindle program too. It's called the Kindle Unlimited. So you can read that. I think it's free if you have a membership and you pay a certain amount per month. And then you can read the book, kind of borrow it like a library. If you want to attend future webinars, you can go to Eventbrite and sign up for those webinars. Most of them are free, and they're on things like back pain, neck pain, whiplash, and joint pain. But we also talk about lifestyle changes, stretches, strengthening, things you can do to better assist your body in the healing process, especially when you're coming to the clinic or going to see a health professional. We're located on Dixon Avenue in Kelowna, and my email address, DrCary Yurkiw, gmail.com. If you have any questions, I'd be happy to answer those for you. You can send me an email. On social media, we're on Instagram, Facebook, and Twitter, all the same handle at DrCary Yurkiw. And on YouTube, the same handle. So subscribe to our channel, follow us on social media. You'll get tips and different things you can do to help your spine and your joints. We do have a podcast on Anchor. It gets distributed through Apple and Spotify. It's called Super Healthy. So you can catch recordings of these webinars on the podcast. And my website, www.caryyurkiw.com. We're currently accepting new patients. We're offering our new patients 10% off. If you use the code NEXTSTRETCH, just to let us know you've been on this webinar, we will take 10% off, and that expires in a week. So you have till October 27th to use that coupon. I'd like to thank you for joining us today for our webinar, Stretches for Neck Pain. I hope to see you at a future webinar and in the clinic in the future. Have a wonderful day.